Committed to Miramar is a weekly radio talk show hosted by Commissioner Darlene Riggs and longtime Miramarian Sherry Abden. The purpose of Committed to Miramar is to keep you in tune with what's happening in the beautiful city of Miramar, covering topics from healthcare, entertainment, employment, to education, politics, and much more. Tune in every Wednesday at 5 p.m. to Radio Unilatina USA. Use hashtag Committed to Miramar.
Hello, Miramarians. Welcome to Committed to Miramar. I'm Commissioner Darlene Riggs, Commissioner of the beautiful, beautiful city of Miramar, and I'm here with
her co-host, Sherry Abden.
Thank you for tuning in, and today we have an amazing show for you. Again, our job is to educate you, the community, on the resources that are available to you. And as you know, I care so much about health, and I think it's because I prioritize things in life, and I'm a big Maslow fan. I think it's the nursing in me, and I do agree with Maslow. Once our physical needs are met, then safety's most priority, then you climb up the hierarchy. But health is such an important piece of that puzzle. I don't believe you can have a good quality of life without being healthy. So our job is to educate the community on how to do that, preventative care. So I am so honored to have with us here today the family of Broward Community and Family Health Center. We have three amazing guests here with us today to talk to you about health and what they provide right here in our backyard. Because as Commissioner of the beautiful city of Miramar, the 33023 zip code is very important to me. And we spoke a few weeks ago about the health status of the 33023, how we've been deemed medically underserved. So here we are. We have a family here of healthcare providers to educate us on how to go about changing that. So I am proud and very, very honored to have with me the family of Broward Community and Family Health Centers. I'm going to introduce them to you, and we are going to have an awesome conversation and educate you, the community, on how to utilize the resources that they have available for you. So I have with me Miss Rosalind Frazier, who's the Chief Executive Officer. I also have Miss Felicia Hart, Chief Operating Officer, and Mr. Jerson Dulis, Director of Outreach and Development. Please help me in welcoming them. Miss Frazier, can you tell us a little bit about yourself and your organization?
Yes. Good evening, Miramar. Thank you, Commissioner Riggs and Sherry, for having us this morning. My name is Rosalind Frazier. I'm the Chief Executive Officer for Broward Community Family Health Center. And I've actually been their CEO now for going on 17 years.
Awesome.
And the centers have been here for over 20 years. We're celebrating our 20th year anniversary.
Happy anniversary.
So thank you so much for allowing us
There's a big party
join you today. Yeah, around February.
Awesome. I'm looking forward to that. You have to celebrate 20 years. Yes. My goodness, that's awesome.
Yes, thank you so much.
Can you introduce your staff?
Yes, sure.
Excellent. Thank you. I see some beautiful people here in the room, and we're looking forward to hearing their responsibility and their piece of the puzzle with the organization.
Yes, I'm going to finish answering your question about what my responsibilities really are with the health center. So my primary responsibility is to ensure that the community's healthcare needs are met through the services that we provide, and that includes getting feedback from our patients or clients that come to our centers, but to ensure that whatever their needs are, that we as a community health center are able to address what those needs are by doing our own focus groups or open discussions and surveys to ensure that the community needs are met. With me is my right hand, my right brain, left brain, Miss Felicia Hart. She's our Chief Operating Officer, but also our Chief Compliance Officer. So I'll let her talk to you a little bit about what she does.
Yes, so I'm responsible. Good morning, first of all. Responsible for the day-to-day operations of our 5 locations, making sure that the flow of the operations runs smoothly, from our medical to our dental operations. Also responsible for everything from billing to human resources resources as well as IT and outreach. So a wide variety of things that I have
to, a lot of responsibility.
Oversee, but it's very important that we do that and make sure that it's at a level that is a high level for the communities that we serve.
Absolutely. And you gave me that beautiful tour, and I can tell it takes a lot to run the facility at the level that you run it, and I'm very impressed.
Thank you. So the other person that's joining us this evening is the charismatic Jerson Dulis. You know, Jerson has been an integral employee in making sure that we have a further reach throughout Broward County. So, Jerson.
Good morning. My name is Jerson Dulis, and thank you, Ms. Frazier. I am the Director of Outreach and Development, and my responsibility, as it is in my title, clearly, but broad as we do as community health centers and nonprofit, engaging our community, raising awareness of our health center, also responsible for fundraising, and wherever else our CEO and COO leads me, we go.
Excellent. And you know, I can tell you and I will be building a strong relationship because of the outreach portion of what you do, because that's my job and my goal, to make sure that the outreach that you're doing does reach the folks that I'm responsible for. And Miramarians, you know, I'm looking out for you. So whenever I bring someone in front of you, it's because I see the need. It's because I'm listening to my community. I'm listening to the researches that are being done. What are our numbers? So I have a big job ahead of me, and Miramarians, I need you to meet me halfway. So the information you're about to hear, please share it with family and friends. Let them know what we have right here in our backyard. Start utilizing it. And I'm reaching out to everyone, insured, uninsured, documented, undocumented, everyone. Please listen up and share this information. So, Ms. Frazier, tell us, how long has Broward Community and Family Health Centers been in existence?
Well, the health center, the Broward Community Family Directly, has been in existence for over 20 years. Primarily, we started out offering medical services. We started with a staff of 13 with 2 locations, and now we have 115 employees that are actually providing services through 5 locations, 4 of them being medical and 1 being dental. So the existence for us and part of our mission is to make sure that the patient's needs are met at a high quality, but also that we are able to, as a patient-centered medical home, that we're able to guide them through any services they need outside of primary care. So in addition to primary care, in the past 3 years, we added on behavioral health. And they provide substance abuse and other mental health counseling services. But recently, we added dental services at our site in Pompano. So far as your center, your zip code is concerned, we have 2 locations that many of the citizens of Miramar are accessing, and that is our center that's located in Hollywood at 5010 Hollywood Boulevard, but also a center that's closer, which is called West Park Community Health Center, which is on Hallandale and 441.
So 2 locations in the 33023 zip code.
I think that we need to steal them to Miramar.
Me too. And you know, I love saying it's right here in Miramar. So I'm praying that one day you are in Miramar and I can say that you're right here in Miramar. But you're very close. You're across the street, literally.
Yes, and we have a strategic planning session that's coming up with our board of directors, and the interest has come up that we open a location in Miramar.
Okay,
so you're not too far off. You're not too far off.
I prayed about it. That's an instant prayer. That's awesome. Do me a favor. Give us the locations again that are in the 33023 zip code.
Yes. The center's name is Broward Community Family Health Center, located at 5012 Hollywood Boulevard. We are directly on Hollywood, right before the 52nd.
Straight down
right
Pembroke
after.
Road, right? Heading east on Pembroke Road?
Actually, it's straight down Hollywood Boulevard.
Okay,
Yes.
Okay, perfect.
That's the
Once you pass
Hollywood
41.
site. Yes.
Mhm.
Then
Awesome.
we have one that is where you were off of Hallandale Beach Boulevard.
A little east of 41 as well.
Right.
Correct.
So it changes to Hollywood Boulevard from Miramar Parkway.
Once you cross for 41, right. That's why I say it's across the street.
Yes.
It literally is, and it's in the 33023 zip code.
Yes, it is 5801 Hallandale Beach Boulevard.
And that's why we share the same zip code too, because
Yes.
again, we shared our zip code a little bit with Hollywood, a little bit of Pines, a little bit of West Park, and that's why the 33023 zip code is a little bit cookie cut. So it's important for folks to know, okay, although you're not in Miramar, it's still the 33023, and it's very close. That's what I love about it. It's not like you're going 10, 15 miles.
Right.
So we need Miramarians for you to know that you're still at home, visiting the center. So now we're going to talk about the services that you offer and who do you service. I know you serve everyone, but please mention that 100 times so that folks know there's no selective. You don't. We're not only catering to those who are insured or documented. No, you serve everyone who walks through the door. You'll find a way to provide them the services that they're looking for. I had a recent experience. I visited a clinic trying to find out, okay, if I'm ill and I'm uninsured and I'm undocumented and I walk into your center, would I be able to get assistance? And that center that I visited, I would not be able to get assistance, which really, I'm baffled. We don't want folks sitting home, being sick and being afraid to access the healthcare system. So I was really surprised. I'm saying, wait a minute, you're right here. And if I'm not feeling well, I have a massive headache, whatever it may be, and I walk in and I wouldn't be able to be seen. Aren't we trying to prevent folks from ending up in the urgent care, ending up in the emergency room, which, is not cost effective? It's better to establish that primary care physician, to follow that primary care physician, get that referral to that specialist, and take care of things in that manner before it even presents itself. So I'm very, surprised that here in this beautiful country that we have such an issue. Can you imagine if the person had tuberculosis and you tell them you're not, you don't want somebody to go, even with the flu, you don't want that, because not only do they impact those at home, but they impact the entire community.
Absolutely.
And my goodness, we have a much bigger problem in our hands.
Right.
So I'm so glad for you guys for being here.
Absolutely. That's the beauty of us as a community health center. Our mission is to provide high quality primary and preventative care services to all persons with dignity and respect. So that doesn't matter socioeconomic status, insured, uninsured. We're there for the community. Our priority is to provide health care services at a quality level. That's what our mission is. That's what our board has established, and that's what we strive to do every day. So we have processes in place that make our center and our services available for everyone. Our goal, again, is to focus on their health, and we don't get into any of those other things. Primarily, we do have systems in place and processes in place as far as what documentation has to be brought in, but that is not specific to citizenship. So we focus, again, on healthcare. So it's very important that the community understands that we are here for them. We are a safety net provider. We accept all insurances, Medicaid, Medicare, and we also have a sliding fee discount available for those who do not have insurance.
Awesome. That's
great news.
That is great news. When we come back, I want to put myself in the shoes of a Miramarian who is seeking health care. What happens the moment that they either pick up the phone, call you, or walk into your center. We're going to walk through that process so they can see how easy it is to go ahead and get health care and establish a primary care physician, get behavioral health, dental, whatever it may be. So thank you so much for being here, Miramarians. Stay tuned. We'll be right back. I'm Commissioner Darlene Riggs, and it's right here in Miramar.
Unilatina International College with campus in Miramar, Florida is a boutique college with focus on entrepreneurship. UIC offers associate and bachelor degree programs in business, tourism, and communications and media. Associate degree students develop their business plan while studying at UIC. Dream, learn, and grow. Join now our business incubator. Learn more at unilatina.edu or call 866-074344.
Committed to Miramar, committed to our community. It's right here in Miramar.
Welcome back to Committed to Miramar. I'm Commissioner Darlene Riggs, and thank you for staying tuned. And like I said before we went on the break, I want to put myself in the shoes of you Miramarians, whether you are insured, uninsured, documented, undocumented, young at heart, it doesn't matter, pregnant, not pregnant, whatever it is, we want you to seek health care, because being healthy really helps you have that high quality of life. And that's my job. My job is to help you improve your quality of life wherever it may be. So today we are talking about health, and we have with us very, very special guests from Broward Community and Family Health Centers, which has 2 locations in our 33023 zip codes. Those of you who live close to 441 or close to Pembroke Road, you could walk there. Literally, those who are close to Pembroke Road, you're 2 blocks south. I think one street light, Washington.
Yes.
Yeah, one street light is your headquarters.
Our headquarters offices is on Hollywood in Washington.
So they go south, they find you. They go east, they find you. They go a little north, they find you. Oh my goodness. Just,
Absolutely.
So you just need west into Miramar to complete that northeast southwest circle.
We will do that.
Yes, we will make sure you have my support, because this is great for our community. Again, can you imagine what we're trying to do if you're closer to home and being able to provide healthcare to all who enters? My goodness, that is really what I've been trying. I'm telling you, it's like the sky opened up. This was meant to be. So God willing, it will happen. You will be in Miramar. So that's our next project outside, once we're done with the show. But tell me, so I'm a Miramarian. Let's take the example of me being uninsured and undocumented. And the reason why I target the uninsured and undocumented, because I know there's a stigma, there's a fear, and I want them to know that there's no need to be afraid to seek health care here in our beautiful country, in our beautiful city. If you're ill, we are about people. We're about, the human aspect of it. No one should have a fear of being deported for seeking health care. That's not even a question that you ask, right? It's not relevant whether they're documented or undocumented. If they walk into your center and they need help, you will provide that health care. So I walk in and I don't have any insurance and I'm undocumented and I'm not feeling well. What happens moving forward from there?
Well, what happens is that you complete our application process. We do ask for some form of identification, whatever you may have, because, of course, we want to make sure we protect privacy and that patients are uniquely identified. And so we're going to ask you some questions. You're going to go through the process just like anyone else would, whether it's someone that had insurance or not insurance. The process is not different based on those factors. So you're going to complete our application process. We're going to ask you for some specific information. If you're someone who is uninsured, as you indicated, then we're going to offer you our sliding fee discount program. And in order to qualify for that, we're going to tell you what you need to bring in. Usually that's proof of income and family size. So whatever your income is, however you're being supported, we're going to ask you for some documentation surrounding that. And then we're going to ask you to list the individuals in your household, because that's important, because it's if you're supporting one person versus 10 people, then your discount will vary depending on that, because your expenses are more significant. So we're going to ask you to just list those individuals. And so based on that, we'll determine where you fall on our discount program, and it will determine what level of discount you will receive. And that could range from a full discount where you only pay a nominal fee of $25 up to 75 or a 50% discount, depending on where you fall on that sliding fee scale.
So I'd like to add something to that, and that's a very good detail to share with you. But what I do want to add to that is there are many that come to us who have non-traditional employment. So they may be sitters, they may do lawn care and things of that nature, and they're working for someone else. We do have an opportunity for them to self-attest what that income is with the appropriate documentation. So although we, for the purposes only for the sliding fee scale, we have to have the information in order to properly assess what that discount is going to be with that family size, including with that non-traditional documentation.
How does your funding work? Is it by donations, grant? How does that work?
Well, it varies. We receive federal dollars that support the discounts that we are able to offer to those who are uninsured or underinsured, for that matter. So it's not just those who are uninsured. So we see all sources. So that we receive federal dollars. We also have patient contracts, meaning client contracts that may come through the state or come through federal programs or even local contracts. Awesome. We have different programs that we actually enter into with private institutions. As an example, that it may be something specific to health. As recently, I think we shared with you in your tour with us, Target BP, which is a partnership we have with the American Heart Association. Awesome. They provided funding for those who are part of that Target BP program, meaning those who have hypertension. They provided blood pressure cuffs for them. We also just finished a contract of services through the state for colorectal cancer. So we were able to do screenings, and for those who were uninsured or underinsured could not afford a colonoscopy, if they needed it after that screening, that program at that time funded it. So our funding comes in different ways, and we try to make sure they are specific to the mission of the health center, and that we've assessed what the needs of the communities are in order to participate in those programs.
Great. That's awesome. And so we have to continue to fight for those dollars. I imagine that's probably one of your biggest concerns, because as you know, stuff are just being cut, and it's a little bit scary. It really is, because we are here on the ground, so to say, and we see the need, and yet those who are higher up, they're not down here seeing the need, seeing the seniors and our youth and our children suffering, but yet, you know, there's cuts and cuts and cuts and cuts. So I can imagine the burden that is, because without those fundings, you can't provide these discounts. And I want Miramarians to know, even once you get your discount, if you need assistance with that $25, that $50, that $75 fee, please reach out to my office. We'll be more than happy to find a way to help you pay for that. Because again, we're a community. You have to do your part. I do my part. And you know my number, 954-602-3152. I also want to give them your best number as we continue the program and give them more information. I have a 266-2999. Is it that's the best one?
That's the corporate office.
We want to give you our Hollywood site.
Okay, perfect.
Location.
Give me that number.
So we'll start with the West Park location, which I think is the closest one. So the number to the West Park site is 954-966-3939. Again, that's 954-966-3939. And that's our West Park location, which is off of Hollandale and 58th. And then our Hollywood location, which is on Hollywood Boulevard and 52nd. The number there is 954-967-0028. Again, that's 954-967-0028.
Excellent. Thank you so much for that information. And we'll give it throughout the show. So those of you who are running to get a pen, don't worry. You'll hear it several times. So we talked about the process, me walking in, uninsured, undocumented, knowing that all I do is fill out an application, questionnaire, you know, how many people am I supporting, that type of, which is everywhere you go. So, excellent. So then I can that very day establish a primary care physician?
Absolutely. Awesome. So typically what happens is when you call to make your appointment, we're going to tell you what you need to bring so that we can do that financial assessment the same day of your appointment, versus having you come in one day to establish the financial component and come back for your appointment. That's all handled the same day for convenience of the patient. So if you're a new patient and you have a 10 o'clock appointment, we're going to ask you to come at least 30 minutes ahead of time, 9:30, to give us time to kind of work through that paperwork and get you established in the computer. And then once that has happened, then you'll see the provider that same day.
Awesome. Great. Now, very important question. Okay, Miramar is extremely diverse.
Yes.
The 3 primary languages are English, Spanish, and Creole. I know you have English speakers.
Yes.
You have Spanish and Creole speakers?
We also have Spanish, Creole speaking provider staff as well as clinical support staff.
Yes.
So at our West Park site, we have Spanish and Mandarin, actually.
And Creole?
We have a provider in Creole.
Awesome.
So staff generally at both sites have both that speak. So we have a family practitioner at both sites. On our West Park site, what I didn't mention before is we do have OB services. And our OB provider, she speaks Creole as well as French, I believe.
Excellent.
And she is has really helped us to grow our program. But they're staff of all languages. And if not, clinical staff is there, support staff, the nurses, our medical assistants, all of them
awesome.
Are multilingual.
I'm glad you provide that, because the experience that I've had in the past, like I said, a few months ago, I walked into a facility right here in the beautiful city of Miramar, and one of the questions I ask is, if I didn't speak English, do you have someone in the facility who speaks Spanish and who speaks Creole? And the answer was no. So a form was stamped for me with a hotline that said English and Spanish, but no Creole. So when I called the hotline, I said, I don't speak English in English. That I would love, because I want to see what they would go through had it been them. And honestly, I wasn't happy, because what happens if there's no one for me to communicate with? I go back home and I'm still sick. God forbid, as it gets worse, I end up in the emergency room, which is what we're trying to prevent. Because by then, whatever it is has gotten worse. So
absolutely,
you have to have that. We have to function in a way with just about everything that we do now these days, with the cultural piece attached to it.
Absolutely,
how we advertise, how we reach out to the community, how everything that we do, because that's just the environment we're in. We're in what we call a melting pot, right?
Absolutely.
And it's so true. You cannot walk down Miramar Parkway and not see, my goodness, just even within one block, you'll see 10 different cultures. That's just how we are. We have to be sensitive to that. So I'm so glad you're sensitive to that. So Miramarians, please do not be afraid to call if your West Park is closer to you, or Hollywood is closer to you, whether you speak English, Spanish, Creole, or any other language. Please give them a call, and they will tell you right over the phone what you need to bring the first time you walk into the center, so that you can go ahead and get qualified and be established a primary care physician. See, I have in my head the whole process of how it works. I do, because I'm in the field. And the way it normally works is that you establish that primary care physician and you get that physical. Do you know how many people don't get a yearly physical? Yes. I even have some family. I have to say, the men are horrible. Yes. I have a lot of brothers. And they're horrible. They really will not do that yearly physical. Look, okay, so I'm so sorry, Justin. We are going to pick on you. You are the only men in the room.
I admit.
Why do you not want to get that yearly physical?
There's a little man code, but brothers, I have to throw it out there. I have 6 sisters, and that's the only reason I get forced. I get to hear it 6 times. It takes me.
So you're tired of hearing your sisters tell you to get that physical, huh?
Yes, I get tired of my wife, of course. So there's about 9 women in my life: my wife, my mother, my mother-in-law, and then 6 sisters.
Lucky you.
I get to hear it 9 times before I actually do it. So.
My brothers, my oldest one, he's in his 50s. He recently got that prostate check, and he said he'll never do it again. I'm like, no. After all this time, I guess he doesn't like the entire poor thing. He was traumatized.
Yeah. And we feel invincible. For some reason, we feel invincible.
You're not.
We're so macho, and
just so you're not.
We learn the hard way.
Every day, those cells get older, and they get older, just like everything else. The gray hairs, that's not beauty. That's you getting old. Stuff starting to ache. That's you getting old. So men, please go get your physicals. Don't wait till stuff starts to hurt, or God forbid you see blood coming out of where blood isn't supposed to come out of. Go get that physical, and whether again you're insured, uninsured, documented, undocumented, insurance, no insurance, it doesn't matter. Call the number. bring what you're told to bring, establish that primary care physician, and then that primary care physician may need to refer you, okay, to another source, whether, it's cardiac issues or your cholesterol's high or behavioral health. Whatever it is, that's how the process is supposed to work. Your primary care is supposed to do that physical, then see, okay, what other specialists you need to go see. And you do that as well.
Yes.
Your physicians would be able, okay, so talk to me about that one.
So generally with our providers,
ooh, I lose track of time. So this is what we'll do, because we need to take a break and, get some of our sponsors in with the commercials. So when we come back, we are going to walk through that process of establishing that specialist, and also even, medication prescription. That's a big one. We have to talk about that because we need some discounts on those meds.
Yes,
so please stay tuned. I'm Commissioner Darlene Riggs. Thank you for tuning to Committed to Miramar. We'll be right back.
Hey Maria, congrats on graduating. Must feel good to be done with school.
Yeah, well it is, but I still have to pass the NCLEX test in order to get a job.
Okay, well, is the test difficult?
Extremely, and I've already taken it 3 times and still can't pass it.
What seems to be your major issue with the test?
I don't know, maybe I don't have the right training, or I don't really understand how to study for the test. And I really want to start working as a nurse. It's so frustrating.
Uni Latina International College is now offering a comprehensive NCLEX RN prep course guided by expert trainer Dr. Juan Carlos Ramirez. Finally achieve success and start your nursing career today. Learn more at unilatina.edu.
Committed to Miramar. Live, work, and play. It's right here in Miramar.
It truly is right here in Miramar. We are here with Broward Community and Family Health Centers, and we are having a blast educating you, our community, walking you through the process as you are a resident in the 33023 zip code, how to go about getting health care, becoming healthy, because again, that is part of having an amazing high quality of life. So we left off establishing a primary care physician and being connected to that specialist, whoever it may be.
So, as a part of our as a part of being a patient-centered medical home, we also, outside of primary care doctors, we establish relationships with different specialists that's in the area. So, although the patient is primarily responsible for the cost of that flow, we still negotiate with providers that are specialists to make the fee more affordable if we have to refer them. As an example, we do have relationships with, as an example, with a cardiologist that's in the area, that's in Hollywood, that more specifically if the patient has to be referred to them, say for an echogram, then we arrange with that patient, at least indicate where you need to go, and they contact and make that appointment with the specialist. The specialist, in turn, after that visit, provide us with the information as the primary care provider as what is the condition, how can we help on the primary care side once they have access to the information of what the specialist had to say.
That's vital. You mentioned something that I teach my nursing students all the time is important in the whole circle. So the primary care physician refers to a specialist, so that specialist takes care of the patient, and they usually prescribe something.
Yes.
What I find is that the communication with the specialist and the primary care physician is broken, where the primary care doesn't know what the cardiologist prescribed. So patients, primary care physician, specialists, it's important for us to communicate back, because the primary care physician should know what it is that has been prescribed. Because what I do, years ago I used to do home health visits where I would do medication reconciliation. I would find so many patients with medications that they have the brand and they have the generic, they don't know they're taking the same thing, the primary doesn't know that the cardiologist, the neurologist prescribed that. So we have 40 medications, and sometimes they're double dosing and don't even know it.
Absolutely.
So it's vital that they connect with each other and let them know, okay, what I prescribed, what care did I provide? And it's the job of that primary care physician to say, okay, I agree with that, I don't agree with that.
Absolutely.
And I think medication reconciliation is something that if we focus on, we would prevent a lot of the adverse effect. And one day, this is a mission of mine. I haven't had time to do it. One day, I want to do an initiative where I gather a number of our primary care physicians and specialists right at our city to just do medication reconciliation, because that is something that is causing a lot of trouble. You just don't know. And
well, you are so absolutely correct about that. That is actually a real important focus for us, is that any patient that goes to the hospital, it's our responsibility to find out that they went, get information what happened during that inpatient stay, and that information comes back to the primary care provider. Excellent. So if the patient was hospitalized, or whatever this may have been prescribed for them in the hospital, that information is then circulated to us as a primary care provider.
Awesome. We
go through the medications that they were prescribed, along with whatever we may have prescribed for them, to assist the patient that this is a particular medication you no longer need to take.
Exactly.
Replace this one that you just received while you were in the hospital. So it is required. It's a requirement of our primary care provider.
Piece that you have that, and that is needed. Absolutely. And sometimes I even see where they're taking it at the wrong time. Yes. It's something that should be taken at night. They're taking. They just don't know. They really just don't know. So if we were to focus on that, so I love that you have that piece. Yes. I know you have OB. Let's touch a little bit on OB because our statistics in 33023 zip code. It's not good. Yeah. It's not good. We have a lot of teenagers getting pregnant. We have a lot of low birth weight babies. We have a lot of babies that are even born dead because of no prenatal care. So I'm so glad you have that component, you have that piece. And, I have a strong relationship with the faith leaders here in our beautiful city, in Sister Cities, Pines, West Park. And I do something called Faith Leaders Brunch every year where I gather our pastors, our fathers, and I give them resources. Yes. They have quite a few community liaisons that just come to the church because their teenagers are pregnant or because they need something. So I want to be able to connect them with you. So you have to come to our next Faith Leaders Brunch and educate our faith leaders, because they get teenagers that come into the church seeking help because, they're pregnant. So talk to us about that component. Which facility has OB?
Yes, our West Park site provides OB services.
Excellent. That's the closest one.
Yes. And on staff is an obstetrician, as well as a nurse practitioner whose specialty is OB. So that team, together with their clinical support staff, they actually take care of, do all the prenatal care. They arrange for testing if the mom is high risk and they may need a neonatologist. We're able to connect them with the specialists in OB that when we can't do it. But we try to do everything that's possible for young women when they do come on. Now, you actually mentioned something that, as an example that we had a few years ago when we started OB, is a young woman that found herself pregnant. And actually had some, she was crying and she was really upset about it. But she was able to talk to our behavioral health counselor that day, who calmed them enough to have that conversation about, what their next steps are. So it's, for us, it's a holistic approach to care, that we're not dropping them off just as like they would in a private doctor's office that wasn't able or didn't have the staffing to refer them on.
That holistic and emotional component that you mentioned is also key, because the younger they are, the more I believe it's needed, because there's there's a lack of comprehension of what's taking place even physically. Yes. And it's just such a scary thing to go through. Yes. Even as an adult, I had my first child when I was 24. Even then I was like, oh my, and I was responsible. I had a job. I had my own place. Even at that point, it was scary. So imagine if you're a teenager. And maybe the other thing I'm thinking of too, we could put something together where we do that preventative education to prevent the unwanted pregnancy to begin with, because part of the statistics is the sexually transmitted infections that has risen in the 33023 zip code. So we do have a lot of work ahead of us, and I'm excited to know that you're right here in our backyard, and that you love our community, and you
Absolutely.
And so trust. And it's hard to find that. I told you I experienced it where I'm really surprised what I saw. So you're like a breath of fresh air. You truly are. So Miramarians, please do not hesitate to give them a call. West Park and Hollywood.
Yes.
West Park, I believe, was 954-966-3939. Very easy number to remember. And Hollywood is 954-967-0028. Beautiful.
If I'm expecting, I know where to come.
Please do. Please do.
I am so done with that chapter in life. Oh no, I tied though. I have 4 kids, so I procreated enough. Yes, I did my job. But that is, because I think of everyone from pre-birth to death here in our beautiful city. Everybody falls under my umbrella. We're not even districted for you to say, okay, I'm not in Commissioner Riggs' umbrella. No, if you live in the city of Miramar, you fall under my umbrella, and I love you, and I'm going to do everything I can to help you have that nice high quality of life. So we've gone through the process of calling in, getting to know what you need to bring, so that when you come for that first appointment, the process goes smoothly, coming a little bit early too, so you can fill out that paperwork. Establishing a primary care physician. If you need a specialist, you connect the primary care physician, connect that individual with the specialist. So now there's another piece of the puzzle that is also key, is the medication. So a lot of times I've learned so much with medication. Even I did an event with Walmart not too long ago where we found that a lot of these medications, they can get them for $1, $5, and so part of it is the physician also prescribing that generic brand, and them even antibiotics are free, so they just don't know. So we need to do an education piece on that. But tell us how that component works with your physicians.
Well, we definitely know any program that can assist our patients. We try to find out about it. So we are familiar with Publix and what they offer for free. We're familiar with Walmart and the $4 program. We're familiar with CVS and what they have. And then there's also the large pharmaceutical companies who offer indigent patients free medication, sometimes from 3 months to a year. So we have staff that's specifically trained to do the application process for those medications. We do charge a small fee for that of $5, but the amount of medication that's received as a result of that is way outweighs the value of the $5. So we found that that's been very beneficial to our patients. So we make ourselves familiar. Our providers are familiar, so they know what's available and how to prescribe based on the need of that patient. So whatever's best for the patient, if there's something that's available on the $4 formulary that works for the patient, then the provider is going to try and work with that patient so that they're compliant with the treatment that they prescribe for them. In addition to that, we also have our own pharmacy, 340B pharmacy. So we have contracted with Walgreens primarily, who operates the 340B program for us, and our patients are able to realize a discount as a result of that. So there are various avenues when it comes to medication and supporting the patient in getting that medication if they can't afford it.
That's awesome. And you know what I would love to see here in the beautiful city of Miramar? We are what you call a focal point. So we have 2 senior centers and we have an adult daycare. So we're very focused on the elderly. What I would love to see is for us to even start a program for those who can't even afford the $5, because Miramar is so unique. We have folks right here in our beautiful city who are millionaires. At the same time, we have folks who are on a steady income, on a fixed income, who really just can't afford it. They're really check to check. So those folks, we want to come, even the little $5 here, $10 there, $25 for the, whatever it is, if we can help subsidize that, that's one less thing they have to worry about. So that is, let me tell you, our interim city manager, I'm pretty sure every time he sees me, his blood pressure rises, because I'm like, wait a minute, this is the issue. We need to resolve it, because I advocate and champion for my community, and I'm sure he dodges me.
This is true.
Yeah, it is. And it's never about me. That's not what it's about. To me, I just want to be able to help other people. It's in my blood. I can't even help it. If I know about it, I'm going to try and fix it. That's just the way I am. So every time I run into him, I'm like, yep, hold up, wait a minute. Let me tell you. Yep.
Yes.
Poor thing. So that is such good information. I didn't even know about some of what you just mentioned with the completely, free and you partnering, for your own pharmacy. That's awesome. So that is great stuff. Miramarians, stay tuned. When we come back, we are going to talk about transportation. That's another key because a lot of times that is what hinders someone from seeking that health care. So if we can pick you up and drop you off, my goodness, what else can we do? So please stay tuned. We will tell you how that works. You are listening to Committed to Miramar, and I am so excited to have our guests here, and I'm excited that you're going to take part of this and be able to stay healthy. We'll be right back.
Uni Latina International College offers an English as a second language program for international students. UIC's high qualified ESL teachers help students develop and master the English speaking and comprehension skills needed for both work and pleasure. Our ESL program also focuses on cultural adaptation through fun field trips and cultural experiences. Start your journey today at unilatina.edu/ESL or call 954-607-4344.
Committed to Miramar. Live, work, and play. It's right here in Miramar.
Welcome back to Committed to Miramar. Again, I'm Commissioner Darlene Riggs, and we have with us the family of Broward Community and Family Health Center. We have our CEO, Miss Rosalind Frazier, our COO, Miss Felicia Hart, and our Director of Outreach, which is now my new BFF, Jerson Dulles, who's going to continue to get his yearly physical. And he's going to influence my brothers and your family members to get that yearly physical.
Yes.
That truly is important. And we also need part of our team of educating the community. We need, one of each individual because, for example, the men, you would be perfect to reach out to the men. I may be great to reach out to the women, the young women. Miss Abden may be great to reach out to our young at heart. She makes them do whatever, she wants. So we also need even our kids to educate from the youth all the way to the elderly on how important this is. And that's why it's good to be culturally diverse. That's why it's good to do things, with your heart. And it's not about the dollars. It's about making our community healthy. It's about, looking at people and listening to them. So I love the fact that you have that behavior component. And that component fits in just about, everywhere. Even the primary care. They may encounter someone where it just, you just need the behavioral aspect of it. They may encounter someone where, they may need to refer them to that cardiologist, that neurologist, whatever it may be. So I'm excited to know that, you're right here in our backyard and you care about our community. So there's another component we're going to tie to this, the transportation. So often that really is the problem where it's not even the fear that that stigma we're trying to overcome. They just have no way of getting there.
Yes, and that's what, again, makes us, I think we pride ourselves in being a patient-centered medical home. Not just a safety net provider, but a one-stop shop. And we ensure that accessibility is for real, not that we're just available, but if you can't get to us, we definitely have transportation to pick you up, not just pick you up, but also drop you back home. So curbside pickup, and it's a $3 fee for round trip throughout the county. And we will be able to even provide transportation to those. For example, we don't only pick up patients within that one zip code to that same zip code to go to that one center. We actually go across the site. So we actually have some patients who are in Miramar that use our dental services, our dental office in Pompano. So we've been transporting those
that's my next
Miramar
topic, and that's awesome. That dental care is so vital because it affects our other system, especially cardiac, because that's one, where the statistics have gotten worse. More people are having heart attacks and stuff. So, and that dental care is a big component to it. And so often, It is pricey to follow, with a dentist, and a lot of folks, with the cavities or having to replace a tooth, that stuff is expensive. Even with insurance, I have a heart attack. I have 6 members in my family. I'm like, how much? I'm like, don't we have insurance? Like, why is this so expensive? So imagine without insurance, the cost. And the statistic that came out for 33023 zip code, the 3 main components were primary care physicians, dental was a part of it, and also the behavior. So you have all the 3 components that I'm looking for.
Yes. Well, one of those that's actually interesting that you mentioned that you've done a lot of homework.
Thank you.
Yeah, I'm just so impressed. Is that the community health centers exist specifically for that purpose? Is that those who cannot afford, that they're able to come to our center, but it's not just that. For me, it is a passion of what the community need is. It's not just we're structured to do this service, but we add on those services based on what the patient consistently demonstrates that they need, and it comes directly from them in many cases. But there is some research that came out recently, and it has been for a while now, that this specific zip code required additional services, and those pockets of poverty or pockets of wealth sometimes overshadow what's needed there. So the transportation piece that Jerson mentioned, we found that we didn't want the patient to only be driven to the closest site. If there was another service that we offered that was at another site, we wanted to do that. The same system applies. If they receive services there, our primary care doctor can see what was done by someone else at that location, because we have electronic health record. So it follows the patient. It's not just at that particular site that they get services.
That's excellent.
So they could go to Hollywood and still have their documentation.
I think sometimes it comes with education, because some people will only think of the dentist when it's a toothache.
Exactly.
Absolutely. And one thing I failed to mention was that this is perfect timing. We have a no-charge month of we provide transportation for our patients at no charge for the month of August. So you can call a hotline right now at 954-998-4343, and we will provide free transportation for our patients across the sites.
Give that number one more time.
The number again is 954-998-4343. That's our transportation hotline.
Excellent. And August is the month of my birthday. That's probably
that's timely.
But Miramarians, if you need that $3, please call my office, okay? Because our goal again is to help you not worry about the minute stuff, and that's why I fight up to make sure we get those funds. And that reminds me, Miramar, we have a number of Fortune 500 companies, and I would love for them to go ahead and support you financially because of what you do for our community. So our Fortune 500, CEOs that are listening, please donate. And I know in February you have a big fundraiser that you do, and you have your anniversary coming up. So we will be sure you have to come back so we can go ahead and advertise that and blast that and let these Fortune 500 companies know, okay, you are here in our community, 33023 zip code. It would be great to throw your resources back at an organization that is doing well in making sure that this community is well taken care of in reference to the health component, because that's what you do. So please, if you're listening, donate, assist them, financially, however you can, and give them that corporate number, because that's where they would call for that one, right? Give them that corporate number.
Our corporate office is 954-266-2999.
Excellent.
They can reach anyone in our offices.
They can also visit our website at www.bcfhc.org. We also have a little more information and also areas on the website where they can donate. We have a donation tab and even more information about our services that we may have missed today. You'll be able to get a full insight of who we are.
bcfhc.org.
That's correct.
Beautiful. And corporate number again, 954-266-2999. Wow, this has been so informative. One more thing I want to add, the follow-up care. I love the fact that you have that. Do you also have a component where you assist with home health, at least with education? You know, I know all the pieces of the puzzle. We cannot forget our home health folks, because a lot of time we want folks to be taken care of at home too, because that's their comfort zone. You know, that's their own bathroom. They can go in the refrigerator. So the more we can assist someone to live, you know, to the best of their ability, depending on their condition at home, the more we support that. So I'm glad to know that you have that component as well. So tell me a little bit about that one, and then I think our hour is almost up.
Yes, so for our home health,
with the referral,
with the home health, any home health needs that's required is a referral from the provider.
Excellent.
So we do have some home health agencies that share their information with us as an opportunity for patients to get an opportunity to meet with that patient. We have many types of them, from Vitas to privately owned.
Great.
It's the organizations that really help, and the same thing applies. Anyone we refer a patient to,
communication stays.
They must send us information back. Otherwise, there's no relationship with them. Because
and that's
for
what
us,
I love
we
about
don't
you.
get to close the circle.
That's a key. And you have a few social workers, right, in your establishment.
Yes.
And social workers are a wealth of knowledge and information. And I love that, because they're the ones who would be able to connect if the patient needs something else. For example, I've encountered where our seniors just want a cell phone to be able to make their doctor's appointment. So your social workers would be able to establish them with the organization that would provide them with the free cell phone. Or because, and I know a little bit of that because, again, we're a social, we're a focal point. We have a lot of social workers ourselves right here in the beautiful city of Miramar. So imagine them connected with what you do. My goodness, we would be such a healthy community, and that's our goal. So you'll see some initiatives coming up in the future where we're just coming out to educate you on what it is that you can take advantage of. So this has been great. We walked through the entire process of being, you know, a resident, whether you have insurance, no insurance, insured, uninsured, documented. It doesn't matter. You call any of the numbers, whether it's West Park or Hollywood. They tell you what you need to bring. You bring that for your appointment, and we have transportation that can, you know, pick you up. $3, and if you need the $3, Miramarians, do not hesitate. Call my office, 954-602-3152. You can establish a primary care physician. If you need a specialist, you can be connected with that. If you need behavioral health, if you need dental, if you need OB, my goodness. So you are a one-stop shop. And our business owners here in the beautiful city of Miramar, please do not hesitate to support, because these are the organizations that are making such a difference in the health status of this community, the community that you call home as your headquarters right here in the beautiful city of Miramar. So I want to say a very, very special thank you to Miss Frazier. Thank you so much for your time.
It's been an honor.
My goodness, Miss Hart.
Thank you.
Thank you. And my new best friend, Justin, you rock.
Pleasure. Thank you.
Thank you for being here. And again, Miramarians, thank you for listening to Committed to Miramar. I'm Commissioner Darlene Riggs, and
your co-host, Sherry Abden.
Have a wonderful, wonderful week. See you next week.